All right. Good morning. Let me start by introducing myself. I am Dr. Zuki Swanzo, and I will be spending the next 2 hours with you. I will start by acknowledging our guests, Excellencies, the G20 African Union, our Minister of Health, Honorable Motsoaledi, Minister of Women, Youth, and Persons with Disabilities, Honorable Chikunga, Minister of Social Development, Honorable Talashe, as well as the CEO of the AU Development Agency, Honorable Bekele Thomas. Development partners, private sector partners, including the Gates Foundation, who are the sponsors, distinguished representatives from civil society, youth networks, and women's networks, the C20, the W20, the Y20, and the Children 20. Welcome. It is an honor to welcome you to this G20 social gathering, a moment where global influence meets moral obligation, and where political will must rise to meet the realities faced by women, by newborns, by children, by adolescents, and by persons with disabilities across the world. It is especially fitting that this convening takes place under the South Africa's G20 Presidency and is guided by leadership from the Global South. The Global South is home to over 80% of the world's children and young people, and to the communities where progress, vulnerability, resilience, and innovation coexist daily. Globally, 42% of the world's population is under 25, a generation that will inherit the consequences of our choices and the pace of our collective commitments. This G20 side event is not an isolated event. It forms part of a broader, coordinated movement advancing the health and well-being across Africa, across the world, and multiple global platforms. It builds on commitments from the Gates Foundation Health and Prosperity Summit of 2025. It also builds on commitments from the Paris Peace Forum's Child Priority Framework of June 2025, and on commitments from the Global Leaders Network and Goalkeepers events in September 2025 and the 8th Paris Peace Forum of October 2025. Looking ahead, the G7 in France 2026, which will serve as a strategic platform to sustain political leadership and financing for women, newborns, children, adolescents, and disability inclusion. So today's gathering is a continuation of global momentum, a convergence of political, financial, and social leadership towards a single shared goal: to protect and expand the progress we have already made. Talking about the progress, we must acknowledge that the world has made significant gains. Since 2000, maternal mortality has declined by more than a third. Under 5 mortality has been nearly halved. Newborn survivals have improved, and vaccination coverage, HIV treatment, malaria control, and nutrition programs have saved millions of lives. More women now access antenatal care, more children survive the first month of life, and more adolescents are in school and connected to information. These are victories that are won through investments, science, solidarity, and system strengthening. But today, that progress is under threat. Global shocks, economic pressures, conflict, climate change, pandemics, and weakened health and social systems These reverse these decades of advancement. So the global picture is sobering. 46 countries are already off track in meeting the SDGs, and 59 countries remain off track in reducing under 5 mortality, undermining SDGs and their interconnected goals. Once progress slips, it is difficult and expensive to regain. And the cost is not only measured in lives lost, but in futures foregone. The G20 represents 80% of the global GDP and carries the influence to shift global trajectories. And the economic case is clear. Child malnutrition alone can reduce GDP by up to 16%. Poor maternal and newborn health reduces labor force participation and lifetime earnings. Exclusion of persons with disabilities costs countries trillions over a generation. Every preventable death or disability widens inequality and weakens long-term productivity. The causes, underinvestment, inequality, exclusion, produce effects that compromise economic growth, social cohesion, and global stability. Healthy women lead to stable families. Healthy newborns lead to thriving children. Thriving children lead to productive adults. Empowered adolescents lead to resilient economies. Inclusive systems lead to lasting progress. So we have two panels today, colleagues. The first will focus on how partners have advanced this agenda and how we should position women, children, adolescent health in the G20. The second will focus on civil society leadership, community systems, youth engagements, representatives of government of South Africa and the African Union. So to welcome us to this event, let me ask you to join me in welcoming the Honorable Minister of Health, Dr. Motsoaledi, to give his opening speech.
People who are in charge of this. Program Director, let me start by acknowledging my two sisters here, global icons in their own right, our former Deputy President, Me Phumzile Mlambo Ngcuka, and Me Narcos Pegele Thomas from the AU NEPAD. Let me also acknowledge the distinguished delegates and partners. Ladies and gentlemen, it is a privilege to address this gathering at a pivotal moment for global health. Today, we stand united under the banner of G20 Social Summit, not only to discuss policy, but to reaffirm a shared commitment that no woman, no child, and no adolescent should die from preventable causes. This is both a moral imperative and a strategic investment in our collective future. For more than 2 decades, global efforts have halved child mortality and significantly reduce maternal death. I'm sure you are aware that maternal death is not just an issue of health or statistics. It's also an issue of development. But we are worried that progress is slowing down. And these gains which we made over the years risk reversal. Persistent inequities remain across all income levels, and Africa continues to bear a disproportionate burden of preventable maternal, newborn, and adolescent deaths. So what we are dealing here, as I said, is not just a health challenge. It's a question of human capital, economic resilience, and social justice. Investing in women's, children's, and adolescent health is among the most cost-effective strategies to drive inclusive growth, stability, and prosperity. The G20 Social Summit provides a unique platform to position women, children, and adolescent health at the heart of global political agenda. And why does this matter? Number one, political visibility and influence. G20 brings together the world's most powerful leaders, anchoring women, child, and adolescent health here, elevates it to a developmental issue and a priority of geopolitical and economic relevance. The issue of multi-sectoral alignment. G20 priorities, human capital, economic resilience, and global public goods align directly with women, children, and adolescent health. Evidence shows that every dollar invested in maternal and child health yields high returns in productivity and the gross domestic product. Number three, South Africa's leadership. As G20 president, we also simultaneously chair the Global Leaders Network. South Africa has a unique opportunity to champion a unifying agenda for global progress because of these two positions we're holding now. This side event aims to catalyze global momentum and investment in women, children, and adolescent health. Together, we seek to position women, child, and adolescent health as a central pillar of human development and inclusive economic growth. We also wish to advance the Global Leaders Network priorities. We wish to integrate women, child, and adolescent health into universal health coverage to reduce maternal and child mortality by half in the next 20 years. Ladies and gentlemen, I wish to reiterate that every time we make a call for universal health coverage, which unfortunately have led into war and fury in South Africa. Every time we mention the word universal health coverage, I personally don't know about the others, think of women, children, and adolescents. Specifically, because in our social ladder, these are the people who are found at the bottom. with no money for their health care, with no money for prevention, with no money to take care of their healthcare needs because of the financialization of health, which is slowly, globally, turning health into a marketable commodity right under our noses. Some of us are not going to fold our arms and keep quiet. We're going to talk, regardless of the abuse we receive every time we mention this. We are not going to be silenced, because I can assure you, if we allow financialization of health to continue at the pace at which it's doing, we are all finished. That I can assure you. We need to expand access to sexual and reproductive health and rights. And we need to mobilize sustainable and innovative financing, including domestic resources. We need to secure language in G20 Social Summit that commits to protecting women, newborns, children, and adolescents from preventable diseases. Now, South Africa's commitment. We have made significant strides in social, reproductive, maternal, newborn, child, and adolescent health, from scaling up immunization and nutrition programs to pioneering HPV vaccine and integrating HIV services. These efforts have improved life expectancy and national productivity, demonstrating the economic and social returns of investment in health. But we know that progress cannot stop at our borders. The Global Leaders Network was established to drive political accountability and resource mobilization across the global south, uniting 10 heads of state committed to reducing maternal, neonatal, and adolescent mortality by 1/3 by 2030. Ladies and gentlemen, when the Global Leaders Network was established to mobilize heads of states to understand and commit themselves to the cause of women, children, and adolescents, I felt it very deeply because of what I once experienced. Remember, on average, generally, heads of states are men. I've got nothing against them, but they are men. Yes. And you know that we men, on these issues, we do not necessarily understand them the way women will understand them. We don't. So what is my experience about this issue? I've got here in front of me these powerful women who are world leaders. I want to share this with you. Back in 2010, I attended an AU meeting in Uganda. Met Yvonne Shaka Shaka, as she's always appointed as an ambassador of this and that in health, malaria, etc., was going to address heads of state. She was built to address heads of state about this issue of women, children, adolescents, maternal health, to make them understand. When she arrived there with a team and they got introduced, one prominent head of state, a man, may his soul rest in peace. I'm not here to denigrate him. I'm saying so simply because he's no longer with us. He's not alive. And he was being genuine in his understanding. He protested. He said, what? We are gathered here to talk about extremely important issues of state, which are very difficult. And you want us to pause and listen to issues about breastfeeding. Yes, that's how he put it. And he said, guys, we don't have time to waste. The state issues that we're here to discuss are very heavy for that, to give us time for that. But you know, Yvonne is always wide awake. She gave an answer I personally would not have thought about it. She said, Mr. President, if your mother did not breastfeed you, you would have been head of state today. Now, I want men and head of state to know that if their mothers did not successfully bring birth to them, nurture them, deliver them, breastfeed them, and do all the things that mothers do to us, they would not have been a head of state. And we are here to remind them, now that you are head of state, please take care of the origins of life. That's where life origins. That's where it starts. And if we don't take care of that, we must never, ever dream about development in this world. So the time for incremental change is over. We need bold, coordinated action. Government must prioritize this issue. Development partners and private sector must mobilize and understand that when we talk about universal health coverage, it's not an attack on them. It's an affirmation of those who cannot pay for their health, because health is a human right. It can't be a marketable commodity that plays around the stock exchanges of this world, as we can see it happening. So we are calling over the private sector. It's not an attack on you. It's an affirmation of the fact that health is a human right. An affirmation that women, children, and adolescents have got a place under the sun. An affirmation that your economies and your businesses will not flourish if women, children, and adolescents don't find their place under the sun. Back in 2010, when we in South Africa launched the world's biggest HIV counseling, testing, and treatment campaign, who was dying? Who was doing the dying? It was women. We were losing women at the rate that nobody could sit back and allow that. We now launched this campaign. And questions were asked. Can you afford it? I remember being asked that question, just like we are being asked if we can afford universal health coverage or NHI. Can we afford it? And I had one single answer, which I gave at all available time. Can we afford not to? Can we afford not to? And today I'm standing here to tell those who used to question these issues about affordability when it comes to women, children, and children and adolescents. I used to tell them, if back then in 2010, South Africa did not launch this program, many of their businesses today will have collapsed, because nobody can build an economy with sick people. If we look at the maternal mortality rate at that time, many businesses will have collapsed because of absenteeism, because of loss of productivity, because of loss of morale, because people are spending more time in funerals than in factories or areas where they need to build the economy. So this is not a matter of expenditure, it's a matter of economic development. Civil society and youth, we need to amplify voices, fight stigma, and hold those of us in power accountable. And global leaders, please, let's endorse this program as a standing priority in G20 and other AU agendas. That's a dream of some of us, that every time G20 meets, they must discuss this issue. And every time AU meets, we must put this issue of women, children on the agenda. It must be a standing agenda. And this is why you are here today. to push world leaders to understand that this is an important standing agenda. So let's ensure that the declaration emerging from this summit reflect our shared vision. Investing in health is investing in equity, in resilience, and prosperity. Thank you very much.
Thank you. Thank you so much. Thank you. Thank you. It's a moral imperative. We are not going to fold our arms and keep quiet, says the Honorable Minister. Another round of applause, please. So as the Honorable Minister has indicated, we have powerful women. We have the Honorable Chikunga, we have the Honorable Talashe, but we also have our keynote speaker, who is also the G20 Social co-convener, Dr. Mlambo Nguka. So we have quite an amazing lineup for you. Without wasting time, let me welcome Honorable Chikunga to give the opening speech. Let's give a warm welcome. Sorry. She's not here. Okay. While we wait, can we move to Honorable Talashe? Is she also not? She hasn't arrived. Okay, it seems they have not arrived. Do we have the African Union Development Agency CEO? Yes. Honorable Bekele Thomas. You're welcome.
Thank you, the incredible MC. Thank you very much. And good morning, everybody. It's so wonderful to say I'm present, right? So, Your Excellency, my dear sister, Dr. Phumzile Mlambo Nguka, co-convener of the G20 Social Summit, Your Excellency and dear brother, Dr. Aaron Mosweldi, Minister of Health of the Republic of South Africa, Your Excellency's sister, in absentia, Madame Siliswe Chikunga, Minister in the Presidency, representatives from the G20 member states and all governments represented in the room, representatives of the civil society, academia, and think tanks, private sector, and also development partners that are here. I would also like to recognize all representatives from the health sector and institutions championing women, youth, and adolescent health. Good morning, everybody. Allow me to congratulate, first of all, the leadership of His Excellency President Cyril Ramaphosa, chair of the G20 this year, and indeed the entire government and peoples of the Republic of South Africa for your leadership and wonderful hospitality throughout this season of the G20 meetings. You have done us proud as Africans by convening the very first G20 on African soil, providing an opportunity for Africa to shape the global economic governance discourse. And I would like to say, Minister, since last week, actually, when we were together, you were really carrying the agenda on health for Africa. And I really want to thank you. And you have been always spot on. Thank you very much. It's an honor for me to deliver this brief remark as the Chief Executive Officer of Africa's premier development agency, the AUDA-NEPAD, and on behalf of the millions of African people that we serve. Today's conversation lies at the very heart of the African Union Development Agency NEPAD's mandate. As the continent's delivery mechanism and implementing agency, entrusted with the vital responsibility of driving Africa's socioeconomic development, serving as the technical interface for all development partners in the continent, advising, strengthening, and building the capacities of member states and regional institutions, incubating, coordinating, and executing innovative and catalytic regional and continental programs and projects, including in health, which is very important, and well-being, and mobilizing resources in partnership with governments, development partners, private sector, philanthropy, and civil society. The African Union Development Agency sits at the very heart of driving women, youth, and adolescent health as an important pillar of Agenda 2063, the Africa we want. And we have not done enough, but we should do more, and we are committed to do more. As you may be aware, we are currently implementing the second 10-year implementation plan of Agenda 2063. Women and youth are really rightly at the center of this. Aspiration 6 of the Agenda 2063 calls for a people-driven Africa, unleashing the potential of its women and youth, where women and youth are not passengers or just recipients, but drivers of change, partners and architects of their own prosperity and that of the Africa we want. Excellencies, ladies and gentlemen, today, we have done so much. Yes, the program director has mentioned that, but it's not enough. Because today, approximately 5 children die each year before their 5th birthday. Nearly half of these deaths occur in sub-Saharan Africa. We lose a woman every 2 minutes due to pregnancy or childbirth, again, 70% of which are in sub-Saharan Africa. Nearly all of these deaths could be prevented with access to quality, affordable, safe, and equitable healthcare services, including the proper nutrition and access to quality care by a trained health provider. Currently, about 59 countries are expected to miss the 2030 United Nations Sustainable Development Goals for reducing under 5 mortality to 25 per 1,000 live births by 2030, while approximately 64 countries will not meet the SDG target for neonatal mortality to at least 12 deaths per 1,000 live births by 2030. We are also off track to meet the global SDG target for maternal mortality. Currently, about 9 African countries have reached the SDG targets for reducing under 5 and neonatal mortality rates, and no other African countries are currently projected to meet these targets by 2030 without accelerated, determined, and bold efforts. Something has to be done. Far too many children are being lost when they can be saved. And now let me turn to youth. With almost 70%, like you said, Minister, of Africans under the age of 35, Africa is the world's youngest continent and is projected to get even younger with an expected 2.5 billion people by 2050 and almost 3 billion by 2063. And with more young Africans entering the workforce each year than the rest of the world, Africa stands at a decisive moment to harness its demographic dividend and turn it into a driver of prosperity. This dividend, ladies and gentlemen, will not come automatically or by chance. It requires deliberate choices and bold investments, especially in human capital, inclusive development, in education, in healthcare, and in job creation to ensure that this growing working age population can become a productive workforce, a workforce that could put Africa into that prosperity path that we want. And now let me turn to women. This year, ladies and gentlemen, as you know, marks 30 years since the adoption of the Beijing Declaration and Platform for Action, a global commitment to the full realization of women's rights in every sector. While some progress has been made, it has been marginal. Women in many countries, especially in Africa, still face challenges of inequality, human rights abuses and violations, harmful practices, gender-based violence, discrimination, and many of their lives cut short because of a lack of access to quality healthcare services. We cannot accept that women die whilst giving life. It cannot be right. We have to do more to uphold, advance, and secure the health, safety, dignity, and rights and empowerment of women across the continent and across the world. From the streets of Djibouti to the highways of Mombasa, to the villages of Ngozi and Banjul, the voices of women must be heard and their well-being prioritized. Simply put, Africa will not rise if women do not rise. Yes, I do agree with you, Mr. Minister. Excellencies, ladies and gentlemen, urgent action is required to accelerate progress and expand access to reproductive, maternal, newborn, and child health. Africa's health transformation is not only about saving lives, but also about shaping a continent that is competitive, resilient, and prosperous. By reframing our understanding of health, we are advancing a powerful truth that a strong health system is the foundation of resilience, productivity, and prosperity. It's also a cornerstone of Africa's competitiveness in global markets. Therefore, health equity is inseparable from socioeconomic transformation. Let me offer 3 practical solutions that should be considered to fast-track the realization of women, youth, and adolescent health in Africa. Firstly, we must focus our energies on integrating maternal, newborn, and child health services into universal health coverage, like the minister said, ensuring that they are included in national insurance schemes and prioritizing primary health care within our healthcare systems. Secondly, we must ensure that political will and leadership on maternal, newborn, and child health translate into action. Last year, ladies and gentlemen, we invested $100 million into our African Demographic Dividend and Sexual Reproductive Health Program. This was to advance the maternal, newborn, and child health agenda as a critical intervention in harnessing Africa's demographic dividend. Through this program, we have provided catalytic funding to member states and regional economic communities to strengthen governance, coordination, and integration, policy advancement through evidence-based research, which influences policymaking, as well as advancing high-level advocacy, capacity development, and technical assistance. And building on this program, we recently launched the 24 Priority Medical Products Initiative, wherein we have identified 24 essential medical products to be manufactured in Africa. And of these, more than 65% are especially for maternal, newborn, and child health. We cannot continue to import our essential products from abroad. We have to produce them within Africa. And we have also identified 45 manufacturing industries, some at their infancy, but others mature that could do it. They just need the political support and also the financial and technical support that they require. And therefore, this will help us reduce dependency on imports of medicines, which currently stands at north of 75%, leaving our health systems vulnerable to supply chain shocks. South Africa should lead. Your Excellency, Honorable Minister, South Africa should lead in this.
Mhm.
Thirdly, we must redouble our efforts towards domestic resource mobilization. With ongoing global challenges, traditional funding partners are redirecting their priorities, making global ODA uncertain. That is why we must fund our own development as a continent. And we have started helping member states through our program, Investing and Financing Africa's Health, the PFAP, by introducing resilient financing models such as blended finances, the public-private partnerships, impact investing, and regional health financing hubs to crowd in private sector investment in the health sector. And mind you, the health sector is really a very good business, and it makes good business case. If we really make sure that the environment is conducive for the private sector, this is an area where, our young ones should invest. And this will help us in closing the annual $66 billion funding gap, a funding gap of $66 billion annually for Africa's health sector. Fourthly, we must depoliticize sexual and reproductive health and rights. And see investing in SRHR as investing into the future of our women, our girls, our boys, and in the future of our continent. As the African Union Development Agency, NEPAD, we will push to make women, youth, and adolescent health a continental priority, and I agree with you, Honorable Minister, by lobbying that it becomes a standing agenda item at the African Union. Because we have to understand that maternal, newborn, and child health are the foundations to health equity, particularly for women, youth, and children. When we address these issues, we strengthen majority of the health system. Additionally, maternal and child health outcomes have become a critical development indicators that reflect broadly on education, gender equity, and social development of a country. So this has to become a key priority in countries' development agenda. In conclusion, Excellencies, ladies and gentlemen, my hope is that today's session will go beyond discussions, strategies, and commitments, but that we would translate these into tangible programs and projects that will be accelerated to drive real change for women, children, and adolescent health, and thereby demonstrate the leadership that the millions of our people are yearning for and expect of us as leaders in all sectors of society. It's only when we work together that we can realize the Africa we want. An Africa where its citizens are more empowered and productive, with a high standard of living, quality of life, and well-being for all, and an Africa that is prosperous based on inclusive growth and sustainable development. And in addition to that, the African Union Development Agency has many programs for women, for youth, but what we need to do is we are not lacking programs and projects, and I'm sure my dear sister would agree. Actually, when you go to countries, development partners programs are overcrowding the space. What is important is to make sure that these projects are impactful and they deliver results for the citizens. And coordination is effective. We cannot get resources, just on behalf of Africans and not deliver. We would like to ask member states to make each development partner to be accountable, to have impactful programs so that we can see results in the field. And therefore, I wish these deliberations fruitful and indeed practical discussions. And as your development agency, we stand ready to collaborate with all partners to ensure that this becomes a reality. I thank you very much. Have a wonderful day.
Thank you. Thank you so much for that opening speech. Yes, indeed, 2030 is around the corner, and there is a need for accelerated, deliberate efforts. Thank you very much. Thank you, Excellencies, for your interventions and your leadership. Your advocacy and political will is very critical. It's a critical component in advancing issues of women, children, and adolescents' health. Ladies and gentlemen, now I want to welcome, or rather introduce, our keynote speaker, who is not a stranger to you or anyone in this room. She's not a stranger to issues of gender, to issues of health of women, children, and adolescents. Dr. Phumzile Mlambo Ngcuka. Woo! Allah, Allah!
Thank you very much, Honorable Program Director. Thank you so much for hosting us so graciously. Honorable Ministers, Excellencies, and distinguished guests, Executive Director of UNICEF, Catherine Russell, my sister, Madam Nados Bekele Thomas, Chief Executive Officer of WNCAH, our young people who I can see are in the house. Thank you for being here. I'd also like to thank the leaders of the different engagement groups that made this possible. Thank you so much for all the work. I want to start by apologizing for the weather. South Africa would have wanted to give you a much better summer, but there's climate change. We also don't know the summer that we have and we've had this year, where we are wearing jackets in the midst of summer. Hopefully, we can manage this. I also want to thank you for honoring us and turning up to make this G20 successful. Kai kapa kai. As a co-convener of G20 Social and the team that has worked very hard to organize this summit, we are really thankful that you were able to be here, and we apologize for any inconvenience that you might have experienced. We wish that the next 3 days will be fruitful, meaningful, and destiny-changing, and we rely on you. I am excited that we are here because the Global Leaders Network initiative is alive. And it is alive because you are here, you are supporting it. And thank you also to the leaders who have made it remain as vibrant as it is. I applaud Civil Society 20 for taking the lead in mobilizing civil society voices who have shared and will share with us their concerns and their contribution. Because the wonderful thing about civil society today and always is that they take responsibility. They don't just complain. Thank you for that. I recognize the invaluable contributions of Youth 20, and I am excited that so many young people have such passionate interest on health issues. I wish I was this passionate about health issues when I was young. I was just focusing on apartheid. I might have been much healthier, but you know, late better than never. I am glad that today I know I am a gogo who tries to live healthy, but more than anything else, I am also part of the advocates for healthy living and the support that is required. I thank Women 20 and Children 20 also for the work they have done to have all of you here and to make sure that your voices are heard. The Women, Children, and Adolescent Health agenda is not only urgent, it is indispensable, and political will is critical to realize the change. I will not say a lot about health because so much has been said by the minister and by the speakers before me. I just do want to say that this G20 happens at a time when the world is changing and not always for the better. We are therefore need a platform on this nature, even though it is not, the decisions we take may not be binding, but the fact that we have discussed them, I hope it raises the awareness to all of us to be committed to make the changes that are required. The decisions, recommendations that you will take here must make you want to go back home and do something about it. We must commit to do something next year and the years that follow, not because someone is directing us, because it is the right thing to do. And Africa must do it for Africa. The Global South must do it for the Global South. And we should not expect anyone else to tell us how and what we must do. We are also meeting at a time where the health indicators around the world, both in the Global South and in the world in general, concern us. And many of the challenges that we face are directly related to the ecosystem within which the world finds itself. So it is important that even as we deliberate about health issues, we are also connected to all the other issues that we will be discussing, both in this summit and the other discussions that will be happening around G20. It is still inconceivable that every day more than 700 women die from preventable causes and related pregnancy and childbirth, as Minister was saying. Women die giving life. Something that should be imaginable in the world of today. Sub-Saharan Africa accounts for 70% of these deaths, with maternal mortality rates up to 50 times higher than in Europe. Adolescent girls aged 15 to 19, complications for pregnancy remain a leading cause of death. These are not mere numbers to us. They represent lives that are cut short and futures that are denied. Reproductive rights and reproductive health, also because of the geopolitics, are facing challenges that we have never seen before. In Beijing 30 years ago, we thought that we had taken giant steps moving forward, but sadly, in 2025, it feels like we're moving back. In Beijing 30 years ago, the African women were the one who led the charge on the girl child. Before that, no one spoke about the girl child. The delegations from Africa said there must be something in the Beijing platform for action on the girl child, who is malnourished sometimes in families because she's a girl. A girl child who is forced to marry a man that is much older than her and then suffer the consequences and complications that she will experience because she's a girl. A girl child who's genitally mutilated because she's a girl. We therefore have to define her not just as a child so that we can focus on what is it that we need to address with this particular child of this particular gender. Thank you to African women, because right now, a lot is known about the challenges that girl children face. And today, we still have many complications that affect girl children, despite a lot of progress that has been made, good policies that has been passed by our government, and the activism of many young people and women and civil society in general in changing these situations. Also, all of these problems lead to mental health challenges that we now all know about. Of course, it affects both men and women, but many of the challenges that women and girls face and the mental challenges that they face, it is because they are girls that they find themselves in those situations. It is because they are women that they find themselves in those situations. So as I finish, I would like to just highlight two things. I hope that today, the first step will be to make sure that we locate civil society within the center of this health agenda. G20 Social is about what happens in civil society. So whatever is said here for us will be a key priority. I also hope that women, children, and adolescent, and women, children, and adolescent health becomes a central pillar in the G20 declaration. And we make sure that it is addressed and attended with agency. I trust the chair of the Leaders Summit, our president, President Ramaphosa, who has worked very hard to bring us where we are. We thank him for that resilience. We also thank Prime Minister Starmer of the UK, who has also worked besides him in order to make sure that today this agenda is maturing. Now it is in our hands to take it a step further. Thank you.
Thank you so much. Thank you so much. So I hope we heard that from the awareness that we are all getting today, it must make you want to go home and do something. Thank you so, so much, Dr. Mlambo Nguka. Now we are going to move to our next segment, which is panel discussions. The first one will be led by Kadi Tore. Can we welcome Kadi Tore? and your panelists. I will leave you in her capable hands. She's a seasoned professional with over 17 years of experience in advocacy, communications, strategy, partnership coordination, and program management in the field of global health.
Thank you so much. Thank you so much. And while my panelists come up and settle in, I might just start, first of all, by saying how thankful and how thrilled we are to be in such graceful and inspiring company. Honorable Minister, Mrs. Bekele Thomas, our own international Phumzile, it's an absolute pleasure to follow your interventions. Your words speak of or provide testimonies, I think, for the thousands and millions of women and children across the world, and we couldn't be more pleased. And you have given us scene setting towards where we are and what we want to do. And I want to complement that with some numbers that we've started to hear about this morning, but that I think everyone needs to hear about. So we've heard about the woman that gives birth, that breastfeeds her children, the children that don't have access to educational opportunities because they don't even live long enough to get there. But in terms of numbers, we're really looking at 260,000 women that die every year. And I presume, how many people here have ever watched a football game in a stadium? 2 people. What has happened here? What do you guys do in your spare time? So if you've ever watched a football, European League, any football match in a stadium, that's about 36,000 people. How do you think the world would react if every 2 months a full stadium full of people died? That's what happens to women every year. That's 1 woman every 2 minutes. Every time someone on this stage speaks for 2 minutes, 1 woman will have died, right? And that is less than the 4.8 million children that die every year. Half of them before they reach the first month. These numbers are enormous. We also have 1.9 million stillbirths, which aren't included in those figures. And for Africa, it becomes particularly concerning because we heard that 70% of that mortality happens on the continent. But actually, causes related to pregnancy and childbirth are the leading cause of mortality for girls between the ages of 15 and 19. And we talk about the demographic dividend on the continent and about the possibilities that we have that are linked to our youth population. But what are those possibilities when these are the risks that these women and girls are facing, much linked to lack of access to sexual and reproductive health services? So today I'm joined by a panel of brilliant experts, leaders in their fields that are going to help us think about these issues and what really is happening right in certain places. What are the key issues? What are the success factors that we can help communicate to this illustrious gathering that we have here? Because as Minister Motsoaledi said, the G20 brings together 80% of the world's economies. That's what we're representing here. They're people that can shape global priorities, and hopefully your interventions will help us do that. So I'm joined today by a couple of people that you will see throughout the event over the next coming days. We have Levi Singh, who's the Regional Youth and Policy Officer at SRH Africa Trust and the Y20 Sherpa. We'll have Kobe Smith with us as well, who's the Executive Director of the Guyana Responsible Parenthood Association. Greer Skoman, who is a Policy and Content Technical Lead in the Office of the C20 Africa Sherpa. Dr. Obina Abirim, pleasure, Senior Technical Advisor at the Federal Ministry of Youth in Nigeria. And Dr. John Nyanyuki, who is the Executive Director of the African Child and Policy Forum. As we try to make up for time, I'm going to merge some of the questions that I had for you. We initially wanted you to reflect on what are your strongest examples that you've seen of progress in women's, children's, and adolescent health, really building on sort of what needs to be replicated and what's the reason for that. But I want to start with Kobe, if I may. If you can answer that question, but also reflecting on some of the interlinkages with climate change. I know that throughout this week, we're going to talk about different things, one of which is climate change. And we've seen, obviously, in the Caribbean region with Melissa in Jamaica, that has an enormous impact on these kinds of populations. So can you speak to these issues from that standpoint? And I'm going to sit down and join you guys.
Thank you so much. And thank you for having me in your beautiful country, Africa. I'm from Guyana. I have to tell people, not Ghana, Guyana in South America next to Brazil. But I think, pardon? Even though I look Ghanaian, but yeah. So I think when we talk about climate change, I think now it's pretty much a euphemism. Where I come from, we call it the climate crisis because of the deleterious effects and impacts of the crisis on economies. You can imagine a country like Jamaica in the western southern side that have totally been decimated because of the crisis. You can also understand the context within which Caribbean economies or tourism represents about 33% of their GDP. And if you have a situation of flooding, hurricanes, drought, rising sea levels, that can also impact how women and girls, young people have access to protective sexual and reproductive services, cancer screening, abortion care, which we don't talk about a lot. But also HIV and STI screening and testing. The challenge, however, is that we have to be careful that we do not roll back progress and that we now come to a place where we talk about climate resilience. How can we come together with the private sector, which we don't bring them in the room a lot of times as we should, and even though they're making profits, perhaps double within the past 5 years, we need to pretty much have a conversation with them about investments, social investments, because women and girls are part of their organizations, and they too can really step into the fold and support what we're really seeing. We know that PAHO WHO now has an incredible framework for climate resilient health facilities. What does that look like? And whether governments have the fiscal space to be able to invest in that. But we also have to talk about business unusual and not business as usual. And I say that because business unusual means that we address the inequalities that exists in the climate crisis, right? That we ensure that we are meaningful and intentional about prioritizing sexual and reproductive health services during crises, because usually governments use that as an excuse to say, let's just stop service provision for now because we need to clear roads, we need to build bridges, we need to ensure we have water. But what happens when a pregnant woman is unable to get to the hospital? What happens when a young girl is unable to access contraceptives to address unplanned pregnancies, when we know in sub-Saharan Africa, there's the high rate of adolescent pregnancy, and in the Caribbean, we're not too far away from you. We have the second highest rate of adolescent pregnancy. And so I'm guessing the response has to be a multi-pronged approach to really say that we have to see the investments to be able to respond to those particular challenges. And we also have to be honest and intentional and meaningful to really say that what was working 10 years ago cannot work today. And we have to have this mindset of business unusual because we are seeing rollbacks on rights. We are seeing rollbacks on commitments. Some persons who are supposed to be in the room are not. And so we really have to be able to have that kind of mindset to really shift to encourage the investments as we move forward.
Hello. Thank you so much for that intervention. And we take away a couple of things. One, this idea of doing business unusual through a multi-pronged approach, making sure that we are leveraging the private sector, I think is something that's been mentioned by some of our earlier speakers as well. It's just interesting that you say these services are the first to go, and we saw that during COVID, and we're seeing it now with the cuts in funding. So critical that we are very intentional with that approach. approach. Greer, I want to move to you next, because I know one of the other topics that's being discussed this week is around trade and economics. And we've heard from some of our speakers, I think it was Mrs. Bikila Thomas, who talked about positioning the health sector as a productive sector, who talked about sort of regional manufacturing as ways to advance this. What are your thoughts on how we can advance the trade agenda through health and how we can position women's, children's, and adolescent health within that?
Thank you so much. So I think we can look at that in looking at two pillars. The first is we need to recognize that indeed health already is a productive sector. The Women in Lancet Health study has found that women ultimately are contributing $3 trillion annually in terms of services and healthcare. Critically, half of this is unpaid. We also have more than 6 million women who are either unpaid or unpaid globally. So we need to recognize the health workforce that is driving. And if we are looking for a future that ensures that women, child, and adolescent health is accessible, is delivered in a quality model, and that we ensure that it is sustainable, we need to ensure that those who are currently making the contributions are fairly rewarded for that. So we want to ensure that we have inclusive and gender responsive services. That is the first. Now, turning to looking at a trade agenda within the G20 and how we would want to respond in that regard. When we want to achieve universal health coverage, our goal by 2030, we're saying that we need an additional 18 million community healthcare workers. Within that, we then also need to recognize that there needs to be formal pathways into the health economy that needs to be created. And this is required within your policies, that we reflect and include women who are not currently there. We also need to ensure that our adolescents are sufficiently capacitated and trained. The immediate asks that will accelerate what it is that we are looking for, turning back to health research and development. We would also like to see that the G20 supports a health manufacturing compact, which is really targeting our low and middle income countries. This should be complemented by a financing platform. And we would also like to see greater flexibility when it comes to your IP, when it comes to tech transfers. Some of the good stories to tell that we have in South Africa, I think as we have reflected on this morning, has been what we have been able to achieve within the HIV response. The fact that we are able to provide universal access to postnatal care, the fact that we've been able to drill down to communities, target people at household level, and we've really been able to show how that has increased service uptake. So as we move towards that, and we recognize that we need to center our communities, we need to center innovation within that. We need to also ensure that we put our investment where it is needed, where it has demonstrated impact, and ultimately that will ensure that we have a sustainable response.
Thank you so much for that. So I'm hearing making sure that we're spending the money where it matters, right? So essential interventions that make a difference, innovations, gender responsive services. But I think what I take away from you is really a call for this health manufacturing compact, some flexibility around intellectual property and technology transfers, as well as financing platforms. You referenced adolescents. So I want to move on to you, Levi, if I can. As as the G20 Sherpa for young people, I know you're interested in questions of adolescence. We've mentioned again with the youth bulge on the continent how important that is. So there's been a recognition over the past couple of years of the importance of investing in adolescence, yet progress is lagging. How do you explain that, and what do we need to do differently to make a difference?
Thanks, Kari. Good morning, everyone. Good morning, colleagues, comrades, friends. Good morning. Fantastic. Recognizing their excellencies in the front, and thank you for that fabulous introduction. Look, I think Her Excellency Nados nailed it. We need to look at depoliticizing sexual reproductive and health rights, but I won't stop there. I would say we need to depoliticize adolescence. Adolescence is a political concept. We work in an environment where adolescents are either viewed as little adults or big children, where the needs of a 6-year-old is equated to the needs of a 16-year-old. And if we're going to achieve a demographic dividend on the African continent, we need to ensure that policies and programs treat adolescents as a unique demographic population that require investments. As we sit and have this discussion, the median age on the African continent is 19 years old, meaning the vast majority of the continent is adolescents. How many adolescents do we have in the room? Okay, so there's our first problem. As the Y20 South Africa, as part of our presidency, we had emphatically stated that we will recognize adolescence as a core component of our political program, simply because we understand the political contestation around adolescence. But we must also applaud the leadership of South Africa and many other member states of the Global South. I would say from 2015 to 2025, the discourse around adolescence has changed profoundly. In 2015, we're still fighting for adolescence recognition in the Global Strategy for Women, Children, and Adolescent Health. In South Africa, adolescence is something that we understand and integrate into policy frameworks. Under Minister Motsoaledi, I remember we launched the She Conquers program, which identified adolescent girls and young women. But now, how do we take this understanding to the rest of the African continent, as the AU is now a full member of the G20? And how do we also ensure that adolescents are fully recognized within the United Nations frameworks as well? So that's the first thing. I think we also need to look at the fact that on the African continent and the Global South, we don't really have good ecosystems for human capital formation and development. I see Yuyu from UNFPA here, and I hope he raises this in his remarks. But ultimately, we segmentize adolescents and young people, education sector, health sector, youth ministries that are chronically underfunded, and then ministries of finance. And I think what we need to be advocating for through multilateral forums is to ensure that there are cohesive mechanisms at a member state level that brings these 4 ministries together to coordinate, to ensure that there are human capital development plans that are integrated and informed by the SDGs and Agenda 2063 to realize the demographic dividend. Because right now we don't really have that architecture in place, or it doesn't seem to be working that well. The last 2 things I'm going to say on this topic is that in order to move from policy on paper to policy in practice, we have to realize that the agendas that we have through the Sustainable Development Goals and Agenda 2030 and through Agenda 2063 at the African Union are imperfect documents. They're imperfect frameworks, but they're ambitious and they're aspirational, and they're the best that we're going to get in this climate. They're the best that we're going to get in this polarized climate that ultimately doesn't view gender equality as a priority. We sat in this room in August as the Y20, and we negotiated till 4 in the morning on some days, negotiating gender equality as a priority amongst young people. We had to settle on language from ECOSOC 1997, colleagues, not even Agenda 2030 language from 2015. We had to settle on 1997 language because of the contestation being so profound. And ultimately, gender equality is under threat, yet we're 300 years away from full equality between men and women globally. Young people's rights are under threat globally. Sustainability and the idea of sustainable development is under threat. Health, the right to health is under threat at this time. And ultimately, Agenda 2060 and Agenda 2030 are the only frameworks that recognize these as fundamentals to human development and human capital development. So we have to protect these agendas and we have to advance these agendas. And the G20 can play such a critical role to ensure that we have a critical mass of member states that can defend these rights and advance these rights. And ultimately, we also need to recognize that it's a small minority of vocal member states that are trying to assault these rights. But from the global south, we say, we understand solidarity is a way of life. Sustainability is a way of life. Sustainability is a way of life. The last thing I'm going to say that in line with that is we need to keep focus on the next 60 months. 2030 isn't a far off concept. 2030 is 60 months away. We have 60 months till 2030. Let's keep the focus on that deadline. Let's work with our ministries to ensure that there are 60-month plans. Let's task the G20 with a 60-month roadmap to deliver and accelerate on SDG progress, and maybe a compact on SDGs for Africa within the G20 to accelerate progress for human capital development. The last thing I'm going to say is that our rights, our choices, and our dignity as Africans and people of the global south are not up for negotiation. We'll defend and we'll advance those rights. Thanks.
It's always difficult coming after Levi. I must say, brilliant intervention, except for the part I take that very personally. No, but I think that your points are well taken, and I think I would be remiss to not thank and commend the government of South Africa for the leadership role that it has taken in launching the Global Leaders Network and in really pushing for these agendas as we face backlash from many countries on these issues. So I just did want to say that we have positive examples, and we thank you for that. Maybe building on what Levi has just said, Dr. Obina, your perspective from Nigeria then on what governments can do. He's mentioned what South Africa has done to improve the delivery of services for young people. Can you speak to us about what the case is in your country?
All right, thank you, Your Excellencies, delegates. I will just share what we're doing in Nigeria. Just to say that last week we had our joint appraisal, the GIA meeting in Nigeria, and some of the things that came out from that is that we've now had 17% reduction in maternal deaths and 12% decline in newborn death over the 2 years in 172 high burden LGAs. And one of the initiatives that led to that is what we call the MAMI project, led by His Excellency Professor Patti, who leads the health sector in Nigeria. And I think it's really important to share some of the core characteristics of the MAMI. MAMI means Maternal Mortality Reduction Innovation Initiative and Initiatives. Now, what it did was it targeted the 172 LGAs. LGAs are subnational areas that have the highest burden. Now, this 172 is just 20% of the 774 LGAs, but they contribute about 5% of the maternal mortality rate in Nigeria. So first of all was that little targeting those areas. Secondly was to then understand what are really the specific factors contributing to the death of mothers and children, right? And it was narrowed down to 3 delays: delays in seeking care, delays in reaching care, and delays in receiving quality care, right? And then the final thing that MAMI did was to then design context-specific solutions that addresses this delay using the sector-wide approach or a multi-sectoral approach, right? So basically, this is what has happened in the last 2 years, and we're now seeing this specific result in reduction in maternal mortality and in this specific LGA. But just to say that we're not out of the woods yet, in Nigeria, we still have a maternal mortality ratio that is above 500 per 100,000 live births. Imagine that number. Under 5, mortality of over 110, and newborn deaths of over 41 deaths per 1,000 live births. So every day in Nigeria, about 246 mothers die, and that is a huge number, right? So we're not out of the woods yet. But what we can learn what we can learn from this initiative that has happened over the MAMI initiative over the last 2 years, I want to draw 3 examples that I believe that member states should then replicate in their country. So those 3 key lessons are: 1, we must adopt and invest in focused, data-driven local solutions that address the real barriers women, children, newborn, youth, and families face, right? Most of the times we look at what is happening elsewhere or what research from the global north says, right? We're not looking at what are the real factors that affect us as Africans, as local communities, either in Ogun State, right, in Gambia, in what are those local solutions? It must be evidence-based. In Nigeria, under MAMI, some of the things we did was engaging community healthcare workers, the BMONC and CMONC readiness, climate responsive intervention, and even transport solutions that help bring these mothers, addressing delay in seeking care, right? And strengthening the capacity of healthcare workers to be able to give quality care, right? So that's the first one, that focused data-driven local solution. The second is that government must secure sustained domestic public financing that strengthens PHC as the foundation for women, child, newborn care, right? Now, I would use the word domestic public. Now, if you look deep into the data, right, especially with the shrinking ODA and the AIDS, Africans are actually funding their health domestically, right? If you look at the amount that comes to health, right, total health expenditure, right, for health, it's actually more domestic. But when you then look inwards, you then find out that it's more out of pocket, right, and little public domestic financing. So while we use the word domestic, we need to ensure, right, that there is more public financing. And one of the things that happened in Nigeria is that there is now an increase, and then it must not just be only domestic, it's also innovative financing. So what we have done in Nigeria over the last 2 years is to increase funding through the Basic Healthcare Provision Fund, and now expanding, and this is something I think the Minister of Health South Africa mentioned, expanding the health insurance to include basic emergency care. The government just announced the free cesarean section for women, right? So it's about how do you empanel this basic care for women into health insurance to expand the space. And as Africans, we need to reach the Abuja Declaration, right? 15% for health. That's way we can then begin to move the needle on women and child health. And then the third and final point is we need to adopt a multi-sectoral approach that includes coordinating with ministries of finance, budget, women affairs, and ministries of youth, right? And that's something that we've seen that has yielded results, right? And there's something that the CEO of AUDA NEPAD mentioned, which is our demographic advantage in Africa, which is more young people, right? And I think that this is something I would recommend and advocate for. There's actually a little structural gap in the framing of the women, newborn, child, adolescent health, right? I would advocate today as a panel, and maybe I'm speaking on behalf of many young people, can we add a Y to it? So it's women, newborn, adolescents, and youth health, right? Am I speaking the voices of the youth here? Yeah, so why we need to do that is that when you have an intersectoral approach for the budget and finance, you need to speak in the language they understand, which is something the Ministry of Health South Africa mentioned. What is the return on investment? We know that $1 invested can return about 20 times for investment in mothers, children, and adolescents, right? But then also you need the women and youths as a critical mass to join that advocacy, right? The physical space is shrinking. You need a critical mass to advocate for more resources, for prioritizing health, right? And you can't expect young people who make up 70% of the 100%, right, to join in that advocacy if in framing you don't mention youth health, right? So I would ask that and I must commend the organizers, we have a lot of youth here, so I think they are thinking in that direction. So these are the 3 recommendations I have for member states. Thank you.
Thanks so much, Obina. And I think we heard you loud and clear. Focused, data-driven local solutions implemented by climate resilient, strong health systems that are financed nationally. Dr. Joanne, I want to move to you for our last question as we move forward. So we've heard solutions, right? We know where people want to go. We have our recommendations. Maternal newborn child health services centered within primary healthcare and UHC, increased funding for these things that come not out of pocket from our populations, and then really pushing and strengthening national laws, frameworks, and legislations and policies that are supportive to our issues. But how do we move this agenda forward? Do we need an investment framework and action plan? What specific thing could help us move forward as a group?
Thank you, Kadi, and good morning, everyone. I want to frame my response around the work that I do on children and adolescents. And I want to take a gender lens and focus specifically on examples on the progress that has been made on reducing the prevalence of female genital mutilation, and linked to that, also declining rates of early child and forced marriage. And I want to first give you just 3 important things at work, and which will link to the element of, is there a need for a global financing framework? So I'll start by laying a bit of ground on that. And we found that the rate in decline of FGM and child marriage is varying across the continent. But we have countries where it is almost at 0. We're at 0.2%, for instance, in Uganda, Ghana, Cameroon. And then we have other countries like Ethiopia, Burkina Faso, which are ranging around 75%. But the promising thing is that there is a significant generational decline, where mothers, in the category of ages of mothers, the prevalence will be at about 75%. But in their daughters, it's 25%. That's one generation. So there's things that are working. And some of the things that are working, and I'll list 3 very quickly, I'm conscious of time, is really in all of these countries, they have harnessed the power of community, recognizing that that's where girls live, that's where children live, that's where families and the strongest protection systems for children and adolescents and girls at risk really can reach them quickly. And a lot of these systems which harness on the power of community, which is oftentimes it's community volunteers or extension workers, or even community faith leaders, which are able to then first early detection, quick response, and sometimes even prevention. Taking an approach that looks at a child and recognizes the child does not live a single issue life. A child does not live an education life, a safety life, a health life, a legal life, a policy life, a program life. So it's, if you stop separating children into issues and we have community mobilization around all issues that affect children, then we can see the progress we've seen in Ghana, for instance, and Nigeria. 2 very quick points is, I want to call them not just partnerships, but smart partnerships. Because what does it mean when we say that they're smart? It means some of the good practices we're hearing from Nigeria, the collaboration across sectors, the identifying the specific obstacle, if it's transport for women giving birth in hospital, in birth, having attended birth care. So identifying the specific obstacles and having smart partnerships that are driven by need and not by supply, and therefore are very responsive to their context. And this then means that, of course, you're using local knowledge, local resources, and they're built naturally to be sustainable. And that has worked a lot on ending FGM, for instance, in Ethiopia, because they have used those smart partnerships to develop very high impact, targeted interventions. And targeted interventions because in those areas where girls were at very high risk, for instance, school meals. Again, you feed children, you keep them in school, because when children are at home again, when girls are at home again, they're at higher risk of FGM and child marriage. Other things like youth-friendly services, cash, when we talk of social protection, cash plus, and sometimes conditional, and I know there's mixed views on conditional cash transfers, but sometimes they provide incentives for families. And so landing on the point of finance, I think there's room there's room for the two-pronged approach, where we value what a global financing framework would be in terms of increasing visibility, laying a ground on what has been agreed in terms of financing standards and norms, and really building up on Abuja Declaration. Since 2001, what are we waiting for? It's been a whole generation since the AU had the declaration. We all sat in Abuja, our predecessors, and said 15% of domestic expenditure will go to health. But I feel like where we are right now, a global agreement will be able to elevate not just health, but specifically on women, children, adolescents, and young people. I agree. So that's one. But if we leave it at the global level, then what happens down here? I'm such a strong advocate of harnessing the power of community, but how do you reach communities from global level? You reach them through national plans of actions. And those, yes, and those national plans of action, then South Africa's will be different from Nigeria's, will be different from Guyana's. But there can be an agreed framework on the minimum standards. On these are high impact interventions which have been costed. So for instance, we know how much it costs to immunize a child against measles. I think the last figures I had was like 0.3 cents of a dollar. And so when these are all agreed, then it's easy for countries to then domesticate it, put the budget lines into their national budgets, create very clear goals and targets, which then also hold national leadership to account. Thank you, Kadi.
Thank you so much, Joanne. I think this resonated very well. I heard the audience clapping. So I want to thank you for those interventions, which I think are a fantastic way for us to end. How do we ensure that we're delivering high impact interventions, but anchored from a community perspective and through community-based mechanisms? With this, I want to thank this panel for giving us an extremely comprehensive view of what needs to be done. I think it was extremely clear. Evidence-based, localized, high-impact interventions delivered through primary healthcare, financed nationally, and supported by an enabling environment, legal environment. And we thank you guys for all of the advocacy that you do around this, and hope that this will get taken into the discussions over the course of the week. Thank you so much.
Thank you. Thank you so much. Thank you. Oh, I feel like the enemy. I'm sure you would want to listen to. Apologies. Apologies. We have two panels. And I do apologize, as I've indicated, I do feel like the enemy, but please bear with me. We have a hard stop at 12 o'clock, and we have another panel. I do understand that you would have loved to listen to a lot more of what Kadi and the team was presenting and would have wanted. We did not plan for the engagement for this particular session in the program. Thank you for your understanding. So with that said, I'd like to call upon, and I do apologize to you as well for asking you to please shorten your panel discussion. So I'd like to call upon Dr. Shakira. Dr. Shakira is with a number of panelists. Can they also come to the front? Dr. Shakira is a multi-award winning independent public health practitioner and an activist who's recognized for her work in advancing healthcare across Africa and the globe. So welcome, Dr. Shakira.
So good afternoon, everyone. I would call this Mission Impossible of the G20 Summit. It was meant to be a 35-minute panel discussion, but we're going to change it into a 10-minute elevator pitch session. So I hope that my panelists are ready with their elevator pitches. As mentioned, Johannesburg, South Africa, As a South African, I'm extremely proud that our country and our continent is hosting the G20 summit. This specific panel is on civil society, women's, children, and adolescent health, and making sure that civil society is part and parcel of the G20 architecture. I'm not worried at all. Everybody else was panicking about time, but I'm not worried because for those of us who've worked in civil society, you know you can do the impossible with very little resources, very little time. So for all of you who are from civil society, if you could wave your hand up, it would be great to see you. Whoa! And give yourself a pat on the back, because again, we really do the most with very little. So I'm going to take a seat and introduce our esteemed panelists who are now in the elevator with me. We've got Babalwa Bone, who's actually from Mothers to Mothers, and also previously a community health worker. Welcome, Babalwa. We've got with us Shamila Rajendran from Arrow. Arrow is from the Asia Pacific region, doing incredible work on women's health as well as youth. And Shamila works specifically on community comprehensive sexuality education. We've got with us two distinguished guests who've been part and parcel of W20 and C20, Professor Nanya Bohla Muller. I hope I've said that correctly. Professor is also divisional executive at the Human Sciences Research Council and has also been a co-chair of G20, the gender arm of W20, the gender arm of G20. Welcome, Professor. And finally, we've also got Piwe Tanga, who's the gender lead at C20, so Civil Society 20, part of G20. Welcome. I understand you're also based at Sonke and you're a lawyer by training. So to kick us off with our elevator pitches, I've got one burning question which any of you could answer. Let's take one or two responses. We know that the biggest issue facing women, children, and adolescent health is long-term sustainable financing. What role can civil society play in making sure it's high on the agenda for national ministries, but also for G20? Over to any of you to give us a 1-minute intervention on that to get us warmed up.
Okay, good day. I think it is important to invest in community health workers is one of the strongest and most immediate steps that we can take towards a strong global health system. How are we going to do that? By professionalizing and recognizing community health workers, paying them a living wage, ensuring that they are safe in their working environment, and also making sure that we scale up the proven peer-led models that is trusted, cost-effective, and ready for expansion.
Short and sweet. So part of the sustainable financing agenda, community health workers. Shamila, I believe you want to jump in as well. What do we need to do as civil society?
Thank you so much, and good morning, everybody, and excellencies, and also everybody who's present today. Regarding the financing, I think for CSOs, I think we can complement this good work by, providing evidence, right? When we're talking about CSOs, we're also acknowledging those who are working at the grassroots level on the ground experiences. So they can provide this evidence in discussions like this, in places where we have these negotiations. And also because they are the ones who are exposed to the lived experiences and the realities, right? And they can also do this in a way that I think the language that we're providing to these documentations, because I think it is not right that we are talking about some of these negotiations in a room where this representative from these communities are not present, right? When we're talking about fulfilling and protecting the rights of young people, we have to do it in a room where this representation is there, because if they are not there, we're not actually doing what we're supposed to be doing. So I think this is where CSOs especially can complement this work. And beyond that, I think what CSOs can do is also work hand in hand with governments, with ministries, and also to inform them about What are some of the processes that needs to be done? Now, we know in some regions, it is also documented that doing outreach work, doing mobile services has reduced preventable maternal health risks, especially when, it is climate-related disruptions. So these are some of the innovations. These are some of the initiatives that the CSO should be informing the government ministries and also in global and regional spaces. Yeah, that's all from my end.
To bring financing. We're going to pass over to Professor Nanya now. We have, and yes, do give a round of applause. Thank you so much. Professor Nanya, we've heard a lot about the Global Leaders Network as well, and there's been a concerted effort and push to make sure that we have investment for women, children's, and adolescent health in a 10-year period. What do we need to do accountability-wise? Over to you.
Thank you for that question, and good day, everyone. I think we need to remember that this isn't only about health, so it's also about women's rights, the rights of women and girls. And I think that whenever a woman dies giving birth, it's not a health failure per se, it's a governance failure. So we need to address structural injustices, and we need to close policy gaps and gender gaps, because health without income is not empowerment. So I think we need to institutionalize women, newborns, children, and adolescent health as a core metric of national progress through programs such as this. We need to finance for gender equality and use gender-sensitive budgeting to do so. We need to collect, analyze sex and gender disaggregated data to measure progress. You cannot measure what you cannot count. And strengthen accountability for gender mainstreaming in healthcare systems. So this issue is inseparable from women's rights, from financial independence and inclusive development. And I would like to suggest that there is a formal liaison between W20, Y20, C20, and the new Children 20 to co-create hearings, metrics, gender-responsive innovations, and thereby sustain civil society's strategic role within the G20.
So the institutionalization, that's a key takeaway, which is so important. We're going to shift to you, Mpiwa, and staying with that thread of financing, which is obviously affecting civil society and the civic space, which is shrinking. What does the G20 need to do to safeguard the civic space that we have to make sure that we're part and parcel of the agenda of women, children's, and adolescent health?
Thank you. Thank you for that question, and good morning, everyone. So shrinking civic space weakens our ability to deliver on women and children, adolescents' health. And when women are not able to freely advocate for their needs, then we have a challenge. And I think one of the important things that needs to be done is, first and foremost, make participation real and not symbolic. And what we're talking about is that women-led and community organizations need formal spaces where they can also participate, whether it's a space where, whether it's coordination forums, whether it's spaces where it's budgeting discussions, whether it's spaces where it's monitoring platforms. Can they not be an add-on that is called as a by the way? Can we have civil society and women's rights organizations being part and parcel of the process? And second, there's also the need to protect the right to operate safely. And by that, governments should ensure organizations can register easily, can receive funding without obstruction, and can advocate without fear. And here we need clear political leadership. We need the G20. The G20 should publicly condemn attacks on civil society and protect human rights defenders. You know, that would be a strong signal from the G20 to say that civic space is being protected and taken seriously. And then the third issue is also the issue of funding women's rights organizations properly. If we want these groups to collect community data, to monitor, and to also be able to implement, to be able to engage in policy dialogues, the flexible income, not only just project-based leftovers. So we need investment in women-led organizations to lead to huge gains in transparency. And also we need to make accountability safe. Governments should create clear channels for civil society to raise concerns, submit evidence, and monitor service delivery without retaliation. When groups provide honest feedback, they should be protected and not punished. And finally, there is need to protect digital space as civic space. We know that a lot of advocacy and monitoring now is happening digitally, and governments must protect surveillance, they must prevent surveillance, and they must avoid criminalizing digital expression and protect the digital security of women human rights defenders. Without digital freedom, participation becomes impossible. So these are some of the critical things that need to be done.
And that's what we want to see, part and parcel of G20 and other global platforms as well. Staying with that power. And Dr. Zikiswa, my side vision is quite good. I'm seeing you from the side and you want us to wrap up. But staying with what people really raised, closing remarks from panelists, how do we ensure that civil society is one part and parcel of the architecture and priorities on women, children's and adolescent health is high up on the agenda? A lightning round starting with you, Professor Nanya.
I think quite simply just listen carefully to what we have to say.
Shamila?
I think definitely listening carefully to what we want to say, but also I think it is important that we embed civil societies into the reviewing process, reviewing the G20 commitments, because by allowing them the role to review alongside the government, we will definitely be able to advance the process. Yeah, that's all. Thank you.
And Babawa, your powerful perspective, previously being a community health worker and also bringing the community voice to this.
I would say supporting community health workers, we can deliver essential interventions, and we can able to save up to 6.9 million lives every day with a return investment of $10 to $1. So we need really to invest on community health workers. Thank you.
So this is only the tip of the iceberg. Many of you in the room are from civil society. Let's continue these discussions. Thank you to my panelists. We pulled up 35 minutes in about 12 minutes. So thank you very much. And I do want to add that, I'm wearing my purple today in support of a very strong organization, WNCAH. And as we go into G20 and beyond, let's continue the fight against gender-based violence and femicide.
Thank you so much. That was so powerful. Wow. Viva women, viva! Viva women, viva! Amandla! Yeah, man. Yes, girl. Yes. Shoo, we've come to the end of our session. And I wasn't one of the panelists, but I'll take advantage of my position as a program director and urge that in our conversations about women, children, and adolescents, we don't forget disability. Yeah. Because of the vicious cycle, linkages between disability and poverty. Poverty can lead to disability through malnutrition and poor health. that can lead to disability, and disability can also then lead to poverty. Thank you so much. So in our closing remarks, or rather supporting statements, I would like to invite Yuyu, as well as Johannes Werdening from UNICEF, and Dr. Cynthia Mwase from the Gates Foundation. So they will briefly give their supporting statements, and then we will have our closing remarks from Mr. Thulani Chefuta, who's the chairperson of the C20.
So thank you, Program Director, and honorable ministers, excellencies, colleagues and friends. A very good day, and really let me start by thanking the Global Leaders Network Secretariat and co-hosters for extending invitation to the United Nations system and to UNFPA for this critical event at the margin of the G20 social. And the leadership and strategic engagement of the Global Leaders Network since its inauguration 2 years ago have showcased exemplary model for global health diplomacy and partnership for development. So taking this opportunity, please let me reiterate and reaffirm our unwavering partnership with you on women, children, and adolescent. So also let me just use this opportunity to join all the previous speakers and reiterate the importance of this session, especially from the perspective of Africa, especially when I'm speaking on behalf of my region director for Southern and Eastern Africa. First, and many colleagues mentioned about the demographic dividend, with 60% of the population under 25, and the continent being the only major region with a growing working age population by 2050. This provides and represents the single largest opportunity for accelerated development. So, but at the same time, if this engine of growth is not harnessed, it risks becoming a demographic burden. Therefore, the discussion around reaping the dividends, investing in universal health coverage, especially for women, newborn children and adolescents, is critical. We're also very pleased to recognize the fact that there's a growing recognition that without achieving universal access to primary health care, especially around sexual reproductive health, it's impossible to achieve and deliver UHC. And second, just wanted to emphasize the importance of SRHR and the gender equality. I recently spoke in the Pan-Africa Parliament about 2 weeks ago, and I emphasized that while my generation has benefited from 2 global significant instruments. One is ICPD Plan of Action, one is the Beijing Declaration and a Platform for Action that basically galvanized the actions from the globe for the last 30 years for SRHR and for gender equality. But I'm so deeply worried about the younger generation today because of the erosion to this global consensus. Last but not least, I just wanted to commend the vision and the effort of the Global Leaders Network and its partners in mobilizing and sustainable and innovative financing, including the domestic resources. His Excellency, the President Ramaphosa, during the UN General Assembly this year, the side event hosted by the GLN, stressed and the importance to establish a bridging financing facility for global health. And also the GLN has hosted various knowledge sessions around innovative financing. So please do rest assured our continued partnership with you to leverage technology, innovative and blended financing for women, children, and adolescents. So please count on our collective partnership at the UN and unwavering collaboration as you pursue your 3 priority areas: increase investments, achieving universal health coverage, and upholding sexual and reproductive health and rights. Thank you very much.
Thank you so much. Mr. Johannes Werdening from UNICEF. will give us his supporting statement.
Excellencies, distinguished members, ministers, colleagues, and partners. I will try to be short, just like obviously previous speakers had to be short. But it's a profound honor for me to be here on behalf of UNICEF's Executive Director, Catherine Russell. But let me begin by really expressing our deep appreciation to the government of South Africa for the exemplary leadership and stewardship of the G20 Health Working Group, and really your commitment to advancing global health equity, which is inspiring and which we have so clearly heard from previous speakers, and in particularly also, obviously, the Honorable Minister of Health. We gather at a decisive moment. We have all heard about progress that has been achieved over the past decades, but we have also heard about all the risks that this progress is faltering or reversing. And we know that today a child's perspectives and the child's future still too much depends on where the child is born, in which circumstances. And therefore it is absolutely important to address these long-standing inequities and to deepen the reductions and shift in global health financing. And I obviously want to join what my colleague Yuyu has already said from UNFPA. And if we don't really accelerate progress, and if we don't also mobilize financing, both at the domestic level, and we've heard obviously how the burden is very often shared at the domestic level, but also at the international level, obviously we risk of going backwards, and 4.5 million children at the risk of losing their lives. But we have also heard that obviously progress is possible, and that when we stand together and when we have the right leadership, but also recognizing civil society contribution, communities' contribution, as we've heard, then we can still advance. So protecting the gains is not enough. We must accelerate them. We must strengthen resilient, integrated, and equitable health systems capable of reaching every mother, every newborn, and every child, including those living on the furthest margins. Excellencies, UNICEF stands fully ready to work with the G20 to put child and adolescent health where it belongs, at the center of global and national priorities. Because healthy children are not only the heart of vibrant societies, they're the foundation of strong, peaceful, and resilient economies. The path forward is clear. With stronger partnerships, smarter investments, and unwavering political commitment, we can build a world where every child, no matter where they are born, has the chance to survive, to grow, and to thrive. Thank you.
Thank you so much. And now, Dr. Cynthia Mwase from the Gates Foundation.
Good afternoon, ladies and gentlemen. The Honorable Minister, I think he has left. Yes, but I see Madam Luka and Madam Thompson. It's very good to see you. The Gates Foundation is very grateful to be allowed to be a partner of this particular summit and a sponsor, but also a partner to many of the other organizations in the room. 2025 has been a year of great announcements from the Gates Foundation. In May this year, Bill Gates announced that the Gates Foundation will have 20 years of existence and then will close. And in that 20 years, we intend to spend $200 billion. The money will be spent on 3 objectives, which I want to leave with you today. The first one is no mother or child should die an unnecessary death. There is no greater commitment to what we are discussing here than that particular objective. The second objective is that we want to eradicate infectious diseases and all vaccine preventable diseases. And the third objective is that we will support the programs to uplift people out of poverty, because that is the way to get rid of all, if not most, of humanity's problems. The second announcement was made in June when Bill visited the continent, and he said that most of that money will be spent on these problems in this continent. And the third announcement from the Gates Foundation was made in August, committing $2.5 billion to women's and children's health already. So I want to use those statements to reaffirm the Gates Foundation's commitment to support the statements and the intent of this particular forum, where we say no woman, no child, no adolescent, no youth should die an unnecessary death. Thank you, ladies and gentlemen.
Wow, thank you. Thank you so much. Ladies and gentlemen, Excellencies, there's a commitment from the Gates Foundation. It has been a pleasure being with you. I have learned a lot, and I hope we all have. And as Dr. Mlambo-Ngcuka has indicated, that whatever you learn from here, whatever awareness you gather from this room, make sure that you go back home and do something. So I would like to welcome our last speaker, Mr. Thulani Chefuta, who will give us the closing remarks. He is the chairperson of the C20, my chairperson from the C20. Welcome, Mr. Chefuta.
I'm not sure if many of our guests have been introduced to the South African way of greeting in civil society. Amanda, I'm a tool. All power. Sounds like it. Thank you very much. Program directors, thank you so much for this opportunity and allow us to rise on the already so eloquently acknowledged protocols. And allow us to acknowledge and commend the good work that is done by the Global Leaders Network, which is seizing every possible space to drive this agenda. When governments of the world met in the United Nations General Assembly to celebrate its 80th anniversary, the Global Leaders Network was there to occupy that space. I want us to join together in congratulating the co-hosts of the Social Summit, that it is indeed happening. The co-host, Dr. DP, as I call her, called last night panicking about few things. And once we found solutions, she was happy saying this thing is happening. I do want us to acknowledge the fact that we have redefined what it means to have a side event alongside. I've never seen such a massive side event. And so we can make a bold claim that the G20 Social Summit under the presidency of South Africa is indeed in session, because this is an official event of that.
Yeah.
What we can just appreciate from the deliberations we've had here is that if the right to life is sacrosanct, health is the most significant enabler for that right. So a right to life minus health means that that right is not complete. Health is one of the measures that contribute to inequality. It's one of the most unequal areas of service that you can ever find in our discourse. The Constitution of the Republic of South Africa in the South African context promises progressive realization of socio-economic rights, which fundamentally means that the rights we enjoy today will always be better than the rights we enjoyed yesterday. The rights we shall enjoy tomorrow will always be better than the rights we enjoy today. At the center of those, it is health. Health is not just a social imperative, as many would want us to believe. There is no society that will ever improve on its Human Development Index without investing on health. Human Development Index measures education, health, and economic growth. So it is an economic factor, as some of the inputs were suggesting here. The spirit we get from the deliberations as we're listening here is such that we seem to be of the same view that, and the policy paper of C20 does articulate this point, health alongside education are two most significant public services whose access to quality services must never depend on your socioeconomic status in society. Your access to good quality services on health and education must never depend on your affordability. That's services that must just be done right all the way. We must change the narrative of positioning health as an expenditure driver. It is an investment whose returns and dividends can be seen almost instantly in society. And when the question is asked about can we afford including universal coverage in South Africa, I'm reminded that pre-1994, around 1993, when South Africa was to transition into democracy, some sections of society said democracy and elections are too expensive. We can't afford them. And so the question I want us to ask ourselves is, what could have become of our society if we would have been easy to agree that indeed democracy and elections are expensive? It means we would not even be enjoying democracy to this day. We need, as our theme challenges us for G20, on solidarity, equality, and sustainability. We need more solidarity with women, children, and adolescents on health. The young must subsidize the old. The rich must subsidize the poor. The urban must subsidize the rural. And so that is the most practical way of expressing what does solidarity mean in promoting healthcare for women, children, adolescents, and health. And our call is that as we go into the main platform of the social summit, all of us as non-state actors must get into that platform and demand the establishment of a permanent task force of G20 on gender equality, empowerment of women, health for women, children, adolescents, and youth. Ours is a call to action for collective prosperity. When we make that call, we must appreciate that even for interventions that are geared towards women, women are not waiting to be passive beneficiaries of those programs. Whilst women may be confronted with a plethora of challenges, equally in their heart, they hold solutions to the same problems if provided with minimum support. Amandla, thank you very much.
Thank you. Thank you so much. Thank you. Bye. Thank you very much. That's the end of our session. I am Dr. Zuki Swanzo, the second deputy chairperson of the C20, and that was my chairperson. Viva! Amandla! Amandla! Enjoy the rest of the G20.